Subscribe. 10 Tips for Successful Weight Loss. Medically reviewed by Alyssa Palladino, MS, RDN, LD, CPT, Nutrition, Personal Training, written by Kathleen Davis, FNP, updated on October 9, 2024. 10 Tips. Losing weight. FAQ. Summary. A balanced lifestyle and nutritious diet are key to healthy living and better weight management. Some tips for weight loss include exercising regularly, seeking social support, and keeping a food and weight diary. Carrying excess body weight can increase the risk of serious health problems, including heart disease, hypertension, and type 2 diabetes. Crash diets are not a sustainable solution, whatever perks their proponents might claim them to have. Making gradual, permanent, and beneficial lifestyle changes is essential to lose weight safely and sustain that weight loss over time. This article provides 10 tips for weight management. 10 tips for successful weight loss. Designed by MNT, photography by Ksenia Ovchinnikova/Getty Images and WestEnd61/Getty Images. People can lose weight and help maintain this loss by taking several achievable steps. These include: 1. Eat varied, colorful, nutritionally dense foods. Healthful meals and snacks should form the foundation of the human diet. A simple way to create a meal plan is to ensure that each meal consists of fruit and vegetables, whole grains, and protein. Total fiber intake should be 25 to 30 grams, daily trusted source. A person should also aim to eliminate trans fats from the diet and minimize the intake of saturated fats, which has a strong link trusted source to the incidence of coronary heart disease. Instead, people can consume monounsaturated fatty acids or polyunsaturated fatty acids, which are types of unsaturated fat. The following foods are healthful and rich in nutrients: fresh fruits and vegetables, fish, legumes, nuts, seeds, whole grains such as brown rice and oatmeal. Foods to limit eating include foods with added oils, butter, and sugar, fatty red or processed meats, baked goods, nutrient-poor processed foods such as chips or cookies. In some cases, removing certain foods from the diet might cause a person to become deficient in necessary vitamins and minerals. A registered dietitian nutritionist, RDN, can advise a person on how to get enough nutrients while following a weight loss program. 2. Keep a food and weight diary. Self-monitoring is a helpful tool trusted source in successfully losing weight. People can use a paper diary, mobile app, or dedicated website to record every food they consume daily. They can also measure their progress by recording their weight every week. Those who can track their success in small increments and identify physical changes are likelier to stick to a weight loss regimen. However, it is important to pay attention to whether it starts to feel obsessive or damaging to mental health. 3. Engage in regular physical activity and exercise. Regular exercise is vital for both physical and mental health. Increasing the frequency of physical activity in a disciplined and purposeful way is often crucial for successful weight loss. The American Heart Association, AHA, recommends 150 minutes weekly trusted source of moderate intensity daily activity, such as brisk walking. People who are not usually physically active can gradually increase the amount of exercise they do and its intensity. This approach is the most sustainable way to ensure that regular exercise becomes a part of their lifestyle. In the same way that recording meals can psychologically help with weight loss, people may also benefit from tracking their physical activity. Many free mobile apps can help people stay motivated, accountable, and confident as their fitness improves. If the thought of a full workout seems intimidating to someone new to exercise, they can begin by doing the following activities to help increase their exercise levels: taking the stairs, raking leaves, walking a dog, gardening, dancing, playing outdoor games, parking farther away from a building entrance. Individuals who have a low risk of coronary heart disease are unlikely to require medical assessment ahead of starting an exercise regimen. However, prior medical evaluation may be advisable for some people, including those with diabetes. Anyone unsure about safe levels of exercise can speak with a healthcare professional. 4. Eliminate liquid calories. It is possible trusted source to consume hundreds of calories daily by drinking sugar-sweetened soda, tea, juice, or alcohol. These are known as empty calories because they provide extra energy content without offering any nutritional benefits. Unless a person consumes a smoothie to replace a meal, they can stick to water or unsweetened tea and coffee. Adding a fresh lemon or orange to the water can provide flavor. Avoid mistaking dehydration for hunger. An individual can often satisfy feelings of hunger between scheduled meal times with a drink of water. 5. Measure servings and control portions. Too much of any food, especially those that are calorie-dense, can result in weight gain. Estimating portions is a realistic and helpful tool for many people who do not have access to measuring tools or do not want to use them. The following size comparisons can be useful for monitoring food intake when dining out. A fist is equivalent to about 1 cup, measuring portions of vegetables and fruits. A tennis ball is equivalent to about half a cup, measuring portions of grains such as rice or pasta. A deck of cards is equivalent to about 3 ounces, measuring a portion of fish, chicken, or other meats and meat substitutes. A thumb is equivalent to about 1 tablespoon, measuring a portion of any nut butter, olive oil, or salad dressing. These sizes are not exact, but they can help people moderate their food intake when the correct tools are unavailable. 6. Eat mindfully. Many people may benefit trusted source from mindful eating, which involves being fully aware of why, how, when, where, and what they eat. People becoming more in tune with their bodies may lead to making healthier food choices. People who practice mindful eating also try to eat more slowly and savor their food, concentrating on the taste. Making a meal last for 20 minutes allows the body to register all of the signals for satiety. It is important to focus on being satisfied after a meal rather than full and to remember that many all-natural or low-fat foods are not necessarily healthy choices. 7. Stimulus and cue control. Many social and environmental cues might encourage trusted source unnecessary eating. For example, some people are more likely to overeat while watching television, and others have difficulty passing a candy bowl to someone else without taking a piece. By being aware of what may trigger the desire to snack on empty calories, people can think of ways to adjust their routine to limit these triggers.